I'm Dr. Marsha Sanity,
And I'm Dr. Caleb Moore.
and this is
The Free Smiles Podcast.
Today we're talking about longevity in your practice. So that is in the aspect of ergonomics or fitness or what we do on a daily basis to really be able to do this for as long as possible. So we can decide not to practice, not our body telling us you can no longer practice.
Exactly. I think this is a huge aspect of our career and what we do, and being proactive about it in the beginning. So when we're first starting out in the field, ensuring that we are adopting healthy practices that will sustain us long term in this field. Because like you said, I don't want my body to tell me when I'm done. I want to make that decision on my own. And I think it starts with, I think it starts with what you're doing day in and day out. And I'm going to focus on that from, what I'm doing in my practice, what type of procedures I'm performing, which ones make me feel really good, and evaluating what I was doing during that procedure. That I felt really good at the end of the day, or was I twisting and turning all day long? I think it's really important that we are focusing on that and listening to our body and how it feels, and then correlating, if I had a bunch of extractions that day and I was, twisting on my side or, X, Y, and Z, how did I feel? Versus, hey, I had really tough extractions today. I utilized my assistant and actually, used four-handed dentistry to where I wasn't twisting or grabbing my instruments as much, or I was using indirect vision like I should have been. So that way I feel better, utilizing that four-handed dentistry like we're supposed to and having proper ergonomics throughout the day. But that's not always the case. There are going to be days where you feel exhausted and drained. So how are we combating that? What are you doing at home to combat that?
So what do I do? I guess that's a long history. I also kind of think about going back a little bit is the whole we don't always have control, because we have patients that can't lean back all the way. We have patients that are elderly and they have vertigo issues, or they have a C-spine fusion or this, and it's like they have to be in they're in a wheelchair and they just all these things that you don't really think of. Those are the patients that they should be the anomaly, not the norm in your practice. So learning how to seat a patient properly that's correct for your posture and for your neck. I think it goes back to when I think about where I started in dentistry. So 18, 19 years ago, I was an assistant. So I would have to lean over. As an assistant, you're kind of leaning over more, like you're having to compensate for where your doctor is. But then I started standing. I started standing as an assistant, and that was a huge change for me, because then I could kind of move my body more freely. I wasn't sitting on that annoying armchair, which is supposed to be ergonomic, but maybe in the 80s, like maybe that's when it was considered ergonomic. But learning how to stand and actually stand up straight, use my posture, use my my whole arm and back to retract something, not just using leverage out here. And we can kind of go into the details of that as well. So transforming into how do I stand and sit as an assistant to how do I stand and sit as a hygienist. So thankfully, when I was in a hygiene school, we were told to buy loops. We had to buy loops. So back then, there was only two loops companies, or at least ones that we were in contract with at the university that we were supposed to be buying from. And really, it wasn't that much of it. It was like a 2x magnification. But that changed the way I practice, because when you first start out, when we're learning in Sim Lab, we didn't have loops. And then you get these loops and you're like, wow, I can sit up a little more straight. And now the loops have just changed so much. The technology is so much better. I think we both have ergo loops now. Tell me your experience with going from a traditional loop to an ergo loop, in your opinion.
And like you said, we were both hygienists, and we both had loops at a very early age and stage in our career. They were very different back then. I remember the first set of loops that I had, it was the flip down. So I think it was
the non-customized ones. They were kind of we're just, you can put these
wherever.
It's
a standard, and you have to adjust your inner pupil distance, and they just flip down over the top, almost like a bifocal or whatever.
Or what you use if you have a hobby, those people that have those microscopes and they make little whatever, they'll use those, for a hobby.
Yeah.
building things.
No, yeah. So when I first started, that's what I was using. And like you said, I noticed a huge change in the way that I was practicing, but I was still bending my neck down because it wasn't customized to me. The working distance wasn't set for me. And also the technology was just different. So it was a direct view, of the mouth, but it wasn't like the loops we have today. The new Ergo loops, they have like, it's almost weird to think about. 'Cause have you ever seen those readers? They're like really funny readers that if you're laying in bed, they have like a mirror image and then you can like read a book while you're laying down.
No, but that sounds amazing.
I don't know.
Want that.
Yeah, you should look it up. But it's really funny, the imaging of it. So, and it's funny because when I first got these Ergo loops, my assistant, she's like, I feel like you're always looking at me.
Oh,
She's like, why are you staring at me?
I would have people walk by my cubicle and be like, or like my hygienist, they thought like they were like signaling me or something, or trying to get they thought I saw them. And I'm like, no, I'm looking, because you really do, like with those loops. And the nice thing is, like, there's so many more companies that have them now. When I first bought them, there was like 2. I think I was one of the first people in our dental school to buy Ergo loops. Yeah. And then, I should get a commission for talking about these because we talk about them so much. And I really am a fan. Like, after practicing for 10 years with traditional loops and then transitioning, it took me 1 day to transition from regular to these kind of loops. And I will never go back. Yeah. I could work 5 days in a row, and I didn't have neck pain. I didn't have that extra stress. I think we'll go back into that a little bit, but it was just that little bit of a, like, hey, I'm sitting upright, my hips are upright, my core, and that just goes back into like how I practice in general, but not having to just put that tilt in or lean so much. Yeah. It's just going to be that extra, just less force onto that spine and that little bit of, like a angulation that you're putting. I mean, the physics behind that is insane. Like whatever the angulation is that you put, like that 30-degree angulation with any kind of dental procedure that you need to like look down, it adds like 40 pounds of something on your spine. And I'm sure there's a PT out there like yelling if that's not the right numbers, but it's a lot more weight that you think about. Like, you don't even have to have like a giant head to put, that much stress onto your spine. But if that's like all day, every day, that's gonna add up. Like, that's why, I mean, most hygienists, older dentists that I know that are into their 3rd decade, 4th decade of working, they all have back problems. Yeah. But I've now been into my 2nd decade, almost, going on 20 years in this field, and I don't have any of those things, which kind of goes into what we do on a daily basis. Yeah, and I think, like I was saying, with the change into these Ergo loops, not having that tilt in the neck anymore, not having that pressure on your spine, like you said. I cannot, and I know I'm harping on these, but I cannot stress enough like how much it's changed how I feel. I noticed, after a week of using them, I was like, I feel so much better. Because the technology in them, it allows your neck to be completely upright. And although you look funny like a robot, like you're just looking around. You really do. And you have to teach your assistant to pass differently. Like if you're passing instruments, they need to be in a different focal point. So that's a little bit of a learning curve for like the team to kind of know, where you are, because they're used to passing, I think, above the, I don't know. I forget how it is, but now I need to have to pass differently. Right. But it's passing differently because your field of view changes and where you're sitting is changed. And so it is a transition. I'm not going to lie. I fumbled, I felt like a baby deer for a couple of days using these loops, but you just have to power through it. And then once you're, comfortable again, it's really amazing. And like I said, I think it just goes back to being proactive and knowing the trajectory of if I practice incorrectly, it's, for 30 to 40 years, what is that going to do to my body? And it's easy to say, well, it's just this one procedure or it's just this one patient. But when you do that all day long, that adds up. And so keeping an eye on those things and then being proactive, I'm talking to my friends and I'm like, I'm going to see my physical therapist. Or I think, I was talking to a friend and I was like, hey, can we go get, drinks tomorrow? And I'm like, no, I have my PT appointment. And they're like, oh my gosh, are you okay? Like, what's wrong? Like, did you hurt something? And I'm like,
No, I'm being proactive.
Mm-hmm.
I'm seeing my physical therapist once a month, and I'm just checking in with my body. And I take notes throughout those 3 weeks or 3 to 4 weeks in between my appointments of like, hey, this felt weird or this felt off, and then I bring them to the appointment, and then we're proactive with my care. So I think that's really, really important. But what are some of the things you're doing on a daily basis to just keep an eye on things and be proactive with your health?
Yeah, I feel like that's just a journey of a question. Because I would say, because I started out, like, I wasn't in sports as a kid. I wasn't someone who was athletic. I think I came from just a generation of, like, women weren't supposed to be weightlifting. Like, it was just one of those things that, like, you assumed it was, like, unless you're, like, an Olympic athlete, a lot of the, people, I was a product of the 80s. So, coming out of that time, it was like we did jazzercise or yoga or whatever. So I did a lot of yoga, which I thought, retrospectively, I think yoga was I was a yogi for 10 years. Like, I would go, the first 6 years I practiced yoga, I was there 7 days a week. I was a psychopath. I was like really into it. That's kind of my personality, that I like really get into it. So I did yoga. That was my first introduction to like body awareness, mobility, some strength training. You could argue, but if it was my husband talking, who is a strength coach, he would say that's not it. But really getting that body awareness and that core stability, because I could do a headstand, but I could also do the splits, but then I couldn't do a push-up very well. So it's like, where was that kind of falter in my fitness? But I didn't know any better. I was 20 something, just being like, oh, well, yoga seems healthy, which it's good for mental health. It's good for a lot of things. But as I transition into more of a strength training part of that, thankfully my husband is a strength coach. So I have a personal trainer that walks me through what's good for my body, which is the difference of like, I would go to like these group fitness classes and try to be like, oh, I'd get injured doing this or this because your body's not in a condition to do certain movements. Or, go to those HIIT classes or go to what do they call it, CrossFit thing. So I think customization is what is so important for us. So that's going to your physical therapist, because that person's going to look at your body movements, look for what's weak in your body. And I think the biggest thing that I focus on is the anti-movements of what I'm doing all day. So what's my posterior chain? Like, how am I strengthening my back, my neck, the hips, those types of movements, because those are the things that I'm locked into every day. And that's anyone that has like a desk job, anyone that's sitting a lot. They should be, finding those even just little nuances of things to help increase the mobility in those areas and increase the strength. So it took me a long time to really find why was I getting neck tightness and why was I like locking up or what, all these things. And that to me came from like lower trap weakness and serratus weakness, which is apparently a thing for a lot of people. A lot of neck pain comes from those lower regions into your back, into your neck, that you're not either breathing properly is a huge part too. And I'm not going to get into that because I'm not an expert at any of these things, but these are just things that I've learned through the PTs that I know, through the strength coach that I work with, through just being in the health industry for so long, is that I've been able to go through so much just a knowledge base of what works for my body, but it also I think works for a lot of people that are in our industry. So those lower trap movements, so like, help your back and shoulders and everything actually sit properly, not breathing into your like upper body and your chest and just like, hunching all day long. I think that's a huge part of just what creates tension. So strength training is huge. I think me and you kind of went to an extreme during dental school when we were waking up at 5 a.m. to go to the gym every day.
And I don't consider myself like a gym bro, or like I'm not gonna be doing like these fitness competitions. That's not me. But we were getting after it then. Like we were getting up every day, going like I was benching like 225, which
the
I don't
best
even
deadlift I've
whatever.
ever
But
had
like
during dental school.
I was like, but I guess to your point with that, even though we were big in that culture at that time, I don't think it was the best for my body.
And that's the thing, overtraining. I learned about overtraining through that time period, because I didn't need to be weightlifting 5 to 6 days a week. Right. And that's, again, going back to my mentality of like, go hard. And, from the yoga 7 days a week to now I'm like, obsessed with strength training, and then that's when you have a more, you're going to have a day where you're not feeling like you slept the best. So then you're going to have more likely to have an injury that day or something like that.
And it puts stress on your body in different ways, at work. And like I said, we're not experts on any of this by any means, but it's just listening to your body and know how it's feeling. And when I first went to my PT and I was like, hey, like I'm having some like really bad like trap issues and just upper neck stiffness, and how can we be proactive about this so I feel better and these aren't going to be problems long term. Like you said, it's focusing on those anti-movements. So if I'm doing this all day long or this or that or moving these things or using muscles, where are the supporting muscles and how can I focus on strengthening those as well?
Right. How are you compensating?
Exactly.
Where are you having weaknesses, and then what's compensating to make that happen that day? And that's where pain comes from. And that's one thing that I didn't understand until I knew my husband, was you can truly, like, pain comes from weakness, and that's not like a mental thing to say. It's pain in your body actually comes from weaknesses or compensations. And I was someone who, I was born with scoliosis. I've always had imbalances in my body. I've had back pain literally my entire life. Like I've always had some kind of muscle compensation. Not that I knew that's what it was, but I've had some kind of imbalance where like, okay, this shoulder always felt a little different. I'm always like hunching over, blah, blah, blah. Like my body was weird. Like my teen years, I was the most awkward person. I think I like had a weird kind of gait because I might, whatever. So it was like going out of all those things and then finally learning, like I would get massages even in high school, I would get massages like every few weeks. I would go to chiropractors. I was like, oh my God, this is going to be the rest of my life. Like I'm going to have to, that's just normal. Like you just do these things. And I was a teenager, but then, meeting Ty, learning what like strength and mobility training is, I don't have pain in my body. I don't have muscle tension into my back anymore. I can, do pretty much anything without having pain. I can strength train. I can, pick up skiing and do all the hiking, all the outdoor activities that we do, the golfing, because I'm working on those strength things and working on my weaknesses, and then the pain is gone. So I think that's something that like immobilization and being stagnant and going home and sitting instead of going home and taking a walk or being active. Not that you have to run a marathon. It's like movement in general is just what heals your body and what makes your body have longevity.
Yeah, and it's a huge topic right now. There are a lot of research articles, and it's all over the news about how sitting just affects, it rapidly declines your health.
Oh my God, I just thought of something. Remember when because in dental school, you know what I'm talking about. So in dental school, we had to go to these like interprofessional meetings. So it's like all the different like professions in health would get together for these big seminars. It was like the med school, the PT, the optometry school, all these schools, even the law school. We would get together and have these big seminars, and it'd be like speeches and whatever. And this lady, we were sitting in this huge hall, and she gave us an hour-long speech about how sitting was the new smoking. And I don't argue that like at all, but we're all just sitting there. I'm like,
it was not an hour. It was like 3 hours.
Maybe it was long. 3. I don't know. I blacked out. It was
it was 3 hours long of her telling us how bad.
But now I'm like, well, we're sitting here for 3 hours. Can we stand or take a
Let's
walk?
incorporate some movements into this seminar. Like if this is
it was in the evening too, after sitting all day in class, and then they make you sit. It was ironic, but I know the real intent was there, but.
No. It's great information. But, that's really funny. But it's, and for me, it's knowing that, we can sit here and say you need to listen to your body and strength train and really focus on, where you're compensating, but how are you incorporating that into your daily life, into practice, and what routines are you setting? I know for me, I have a foam roller in the office. I have my resistance bands, and if I had a really tough procedure that I was, if I had to compensate for a little bit for a patient or a situation, for 2 hours, I step out of there. I'm like, oh my gosh, I'm going to go back to my office. Let me regroup and let me follow what my PT has told me to do. But it's making it a priority and finding the time throughout the day. It's even if you just get, you're able to do, 10 reps, of whatever it may be, or just go foam roll, or do, you know, something in your office.
Mhm.
I think that's really important in creating healthy habits. So finding, you know, a routine. Like you said, we shouldn't be. I can tell you now, like, you know, when I was in dental school, I was strength training like 6 days a week, and I was so focused on like body image, and you know, it was just the stage of life that I was in, but I wanted to look good, and I wasn't focused more on like how I was feeling. So, you know, transitioning now into being a practicing doctor, like I said, it's finding that routine for you. And for me, it's been, hey, maybe I have 3 full body strength days. Like I'm going to get that 3 days a week. And then the other days, I'm going to focus more on lighter movements and yoga, taking a yoga class, or stretching,
Mhm.
or going on a walk on a Sunday, like walking 3 miles that day, getting outside, getting the sunlight. So, what are some of the things that you've been doing in your daily practice?
So thankfully, I mean, I would say my first year practicing was the most unhealthy I think I've been,
I agree.
because, you know, we went out from like having this almost like space and time where we had a routine. I mean, me and you, we went to the gym every day together. We went to class. We did this. It was very like, I meal prepped, which, I mean, I would argue that most of my success in life is because I was a meal prepper.
The bone broth that you've always been making.
The bone broth, the organ meats, all those things that I do. But prepare, like setting a day where I don't have to be cooking all the time, so that I'm not eating, you know, shit food for the week, or I'm not having to get takeout. And that's also a financial choice, obviously, too, is preparing those meals. And I know there's like services that will send you meals, but I've tried them. I just don't like having frozen food and then reheating it and whatever. There's a time and place for it, and I've tried it for sure. But I think the meal prepping part was huge. I still do that. I think that was the huge thing that coming out of dental school I wasn't doing, because I was so, again, my personality is get gung ho, like I'm like laser focused on that thing that I'm trying to do in that moment. So all of my energy went into the practice. I was there before everyone. I stayed later than everyone. But that was I didn't even realize how much that took from my capacity, that I like slowly and slowly like stopped going to the gym. I slowly and slowly like came home and would just like lay on the couch, because I was just like, oh my gosh, I'm so exhausted, just mentally sometimes, not more than physically. And then what that turned into was, hey, maybe I need to not be in this practice. So that was part of it. And then the other one was, let me set up my routine to fit into my life. So I found, new practice. I have a gym that I go to that's literally on my way home. So there is no excuse to not get off on that exit and go to the gym. So now I'm back to the gym 3 days a week, sometimes 4 for like that extra like PT day or whatever that may be. And that's huge for me, is really making that part of my routine, because let's be honest, we're humans, and if something is like, I gotta go across the universe to find the gym I need or whatever, not that I didn't do home stuff, but it just wasn't the same for me. I needed to be in an environment that's away from my home to really get focused on that. And I think you can have good home workouts, and like I do a lot of my PT stuff at home, but when it comes to like strength training, I need to be in like a facility. I need to be somewhere to do that, and that's actually not super crazy busy. So the gym that I was trying to go to, it was a lot more busy, it was a lot more crowded, it was a lower cost gym. So the times that I would be able to go, it was like I couldn't even get on the things I needed or whatever it was. So finding that my day-to-day PT stuff, like I've met thankfully a lot of amazing PTs. We're in Colorado, so we have like the strength and conditioning out here is amazing. Like there's a lot of like, I think training, not because I'm an athlete, but I'm training like I'm an athlete, because there's no difference. There's no difference in functional movements when it comes to, obviously I'm not going to be training for like a triathlon. Although my husband would argue that I need to swim more and get more cardio in. That's an aside. But I think training my body to move and function is so important. So yeah.
And something that, you know, resonated with me was, like you said, the transition from, it's all about the environment and the stage of life you're in. So when we had the time to go to the gym and really focus on that, versus stepping in. There was a good 6 to 8 months that I did not go to the gym. I remember I moved out here to Colorado, and I would tell you, I'm like, I'm just in this funk, and I don't know what's going on, but I didn't feel good mentally. My body, was suffering as well, and I think it was just exhaustion and stress, and it wasn't necessarily that I was in a bad situation. It wasn't set up for me. Like I am not a person who I get up early. Like I'll get up at 5:30, but I can't get up at 4 a.m. My body just for me it doesn't work, and I can't get up at 4 and go feel really good about the workout that I'm getting at that time because I'm starting work at 6:30. We have huddle at 6:40. That morning is never going to be the time for me. Okay.
Mm-hmm.
So when I first started, this previous, role that I was in at this office, you know, that was the only time that I had to go and try and work out. So I never did it because it didn't align with what my body was telling me. Like, you're not getting good workouts at this time. It's not meant for you. And I wasn't making excuses. I just, like you said, it just wasn't working for me. So, stepping, how I feel right now, I have joined a new practice, and I have a great associate, I have a great team, we have great hours, and it really works for my life. So I'm able to get off work at, 3:30. I'm so spoiled by that, I know, but get off work at 3:30 and get to the gym before the rush, and I can have that afternoon workout that feels really good for me.
Mm-hmm.
I love leaving work for the day and then going and maybe not even hashing out the day, but just getting that time. I go straight to the gym and then I come home and I cook dinner and meal prep and do all the things. But I think, like you said, just knowing what works for you. And if there are aspects of your life, whether it's work or it's maybe the friend group that you're in or X, Y, and Z that aren't working for you, it's setting time aside to listen to that. Okay, what's holding me back right now? What things do I need to change to put myself in a better position so that way I can do this career and do the thing I love for as long as I want to?
Yeah, so I think the biggest thing was just focusing on those functional movements. And I guess you could argue functional movements mean different things, and I'm not a fitness person. So argue that on your own time. But I think what functional movement is to me is, what do I do every day, and what are the movements that I need to strengthen those things? Like, how is my core? And that's not because I want, abs that are whatever, but it's because I know when I have to lean forward, I'm leaning with my whole body from my core, and I'm breathing through my lower diaphragm. I'm not hunching my shoulders and doing those things. And I think that just the body awareness of that, finding someone who, even at your community gym, you can find someone who's a personal trainer that will give you an assessment for really not an expensive fee. Because I think of expense as in what's the cost for the rest of my life to do these things. And just getting those, like, hey, I need to do this, this, and this, no matter what. Every couple of days a week, I need to do these things. And then I go into, hey, if I have an acute issue, I have a PT that I go to that can do either dry needling or acupressure, or I have a massage therapist, but I really don't see her as much if I'm doing my PT, if I'm doing my strength training like how I should, and if I'm not like traveling. So after a traveling where you're having to like sit somewhere for a long time, I think those are moments where you're like, okay, now I need to maybe get some soft tissue work done. But relying on those soft tissue passive things are not going to be the root cause solution. It's kind of helping that acute situation when really you should be focusing on those strength and conditioning things and those PT things. Yeah.
Well, I think this brings us to the end of the episode. Thank you for sharing your personal experience with health and wellness. I'm really excited for us to jump into next week's episode, which will be focused on financial freedom in dentistry and the different avenues that you can take for passive income and really just have success in that aspect of your life.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.